Hello and welcome back to the HIVRNAtestguide.com YouTube channel, your trusted source for HIV testing with over 4,500 HIV testing labs across the United States. For more information, check the link in the description of this video or the bio section of our channel.
Welcome back to the deep dive. Today we are strapping in for an exploration of one of the greatest, most persistent scientific challenges of our time.
We really are.
The quest for a universal HIV vaccine. This is a battle that has spanned decades. It's defined entire fields of molecular biology, and frankly, it has led to immense frustration.
But that's the key, isn't it? The reason we're doing this now is because researchers are saying that this long fight has finally reached a really exciting moment.
An exciting moment. I like the sound of that.
Me too. And for
Yeah.
you listening, if you want to understand the critical details without slogging through, endless research papers, our mission today is to synthesize what's changed.
Right.
We're moving past the historical basics of HIV, and we're diving deep into the novel research strategies being used right now.
And one in particular, this idea of structurally training or educating the human immune system to fight back.
Against this shape-shifting foe, it's a completely new way of thinking.
And the weight of this research, it just can't be overstated. We have to remember the context here, the urgency. When we look back, the human cost is just staggering. Over 30 million people have already died from HIV/AIDS worldwide.
It's a sobering number. It really is. That figure alone tells you the scale of the devastation.
But what keeps this so urgent right now is that it's not over.
Not even close. The persistent infection rate is, it's the driver. Despite all the monumental progress in treatment and awareness, we're still seeing 1.5 million new infections.
1.5 million.
Globally, every single year.
That is a massive population getting infected year after year. It means the pandemic, while, maybe slower in some places, is nowhere near finished.
It's an active global public health crisis. It demands a final, decisive solution.
And that number, 1.5 million, that's the yardstick for success.
It is. When you consider the economic, social, and just the human costs attached to those new infections, you realize that a successful universal vaccine is the single most powerful tool we could possibly deploy.
It wouldn't just be a medical breakthrough.
No, it would fundamentally rewrite the public health playbook. It would deliver extraordinary global economic relief.
Exactly. It would shift us from perpetually managing a disease to definitively ending a pandemic.
Right. But before we get to the really advanced science of the vaccine itself, we have to look at the tools we have now, the very successful life-saving tools.
We do, because we need to understand why they aren't themselves the final answer.
Let's start there.
Okay, so first, we have to acknowledge the massive advancements in treatment. I mean, antiretroviral drugs, ARVs, they fundamentally changed the fate of people who are infected.
They truly have. Before ARVs, an HIV diagnosis was, it was essentially death sentence.
It was.
Today, they have successfully made HIV what the sources call a survivable illness. And that is a monumental, hard-fought achievement.
It speaks volumes about modern pharmacology. But beyond treatment, the success of using ARVs as prevention is just as crucial.
You're talking about pre-exposure prophylaxis, yes. Pharmaceutical companies showed that by giving these drugs to uninfected people at high risk, you can effectively block the infection pathway.
And pre-EP is a profound advance, absolutely. It saves lives every single day.
It does.
But this brings us to the critical question, right? If the drugs work so well, and we can use them for prevention, why do we need a vaccine at all?
Why isn't a global pre-EP program the answer?
Exactly.
And that is the essential question that drives all this vaccine research. Because while pre-EP is highly effective on an individual clinical trial level,
We're talking over 95% effective.
when taken consistently, yes. But the strategy faces these colossal hurdles when you try to scale it up to universal global prevention.
Walk us through those hurdles. I imagine it goes far beyond just, making enough pills.
Oh, it does. The crucial factor is adherence. For pre-EP to really make a dent in that 1.5 million annual infection rate, people at risk have to take these drugs regularly, reliably.
And permanently.
And permanently. This is not a short course of antibiotics. This is a sustained, indefinite behavioral commitment.
And humans, let's be frank, are just not optimized for perfect, indefinite adherence to daily medication.
We're not. That immediately introduces massive social and logistical friction.
Even in highly resourced countries, right? Adherence rates for chronic conditions often hover around, 50 to 70%?
At best. So now project that difficulty onto global communities, particularly in lower income settings with strained health infrastructure. The problem just compounds.
Okay, so let's get into the practical barriers.
Well, the sources and the annual infection rate remains tragically high. Exactly. Then there's the cost. It's astronomical.
We're talking about perpetually funding medication, distribution, the clinics.
Counseling, managing adherence for potentially hundreds of millions of people for the next century. And that doesn't even touch the social challenges.
Like stigma.
Stigma, privacy concerns, the difficulty of just getting to a clinic regularly for refills. A person may not want their community to know they're taking pre-E, which creates these hidden barriers to compliance.
A vaccine, on the other hand, is a one-time thing, or maybe a limited series of shots.
It leverages the body's own internal machinery to create long-lasting immunity. It just bypasses all those logistical nightmares of daily pills and adherence monitoring.
So that's the core takeaway here. While ARVs and pre-EP are life-saving stopgaps,
the vaccine is the necessary, efficient, and logistically sound tool to truly end the AIDS pandemic.
it removes the dependency on perfect human behavior.
And it bypasses the massive perpetual economic and social costs of the current model.
So the goal isn't just to find a drug, it's to find a systemic, durable solution. And that urgency pivots us right into the fundamental scientific area.
Which is, if the need is so urgent and we have been working on a vaccine for 40 years, why hasn't a standard approach worked yet?
Right.
And this brings us to the unique biological nightmare that is the HIV virus.
We often talk about the flu shot, where we update the vaccine annually to match 3 or 4 circulating strains.
Sure.
That's manageable variability. What is the scale of variability we're dealing with here?
The scale is almost incomparable. The fundamental issue is that HIV has this staggering, almost unmatched genetic variability.
We're not dealing with a few targets.
No. The sources state there are literally hundreds of thousands of different strains of HIV circulating globally.
Hundreds of thousands. Why? Why is it so adaptable compared to, say, measles or polio? Viruses we successfully conquered with pretty standard vaccines.
It all comes down to its replication process. HIV uses an enzyme called reverse transcriptase, and it is notoriously sloppy. It has a very high error rate when it's copying the viral genome. So every single time the virus replicates inside a host cell, it introduces mutations, mistakes.
And a single infected person can produce billions of new viral particles a day.
Billions. So the virus population within that one person is constantly shifting and evolving.
So if you're infected today, the virus that's replicating inside you tomorrow is already a little bit different from the original version.
It's evolving in real time within the host. Exactly. The virus is, as the sources say, so flexible or highly mutable.
It's a master of camouflage.
The perfect description. Every time the immune system tries to mount a targeted response against one version of the virus, that version is rapidly replaced by new, mutated strains. The initial antibodies become irrelevant.
That's its immune evasion mechanism.
It is, and this intense mutability immediately dictates the vaccine strategy we have to use.
You can't chase every strain.
You can. Because the virus is so variable, only a universal vaccine will work. A vaccine that only targets a regional strain or a few common ones is doomed to fail.
The moment that person travels or is exposed to another one?
As the sources stress, no one knows which strain they're going to be exposed to. The vaccine has to provide blanket protection against all of them.
Okay, so if we can't target the parts that are always changing, we have to target the parts that are non-negotiable for the virus's survival.
The functional constraints.
Where are those located?
That leads us right to the critical surface structure, the infamous spike protein or the envelope trimer.
This is what the virus uses to dock onto and enter our T cells.
Correct. On HIV, this spike is highly flexible, making it a moving target. But, and this is the crucial part, the virus cannot change everything about the spike.
Why not? If it can mutate so easily, why can't it just change the entire spike structure?
Because the spike has a very specific job to do. It has to bind to the CD4 receptor on the T cell and then trigger fusion with the cell membrane.
So its function limits its form.
Those functional requirements constrain its variability. The critical scientific task is identifying the sites on that spike that are absolutely essential for that job, the parts the virus keeps constant despite the overwhelming evolutionary pressure to change.
This is where the biological complexity just ramps up, though, isn't it? Because the spike protein is also protected by a thick, sugary shield.
That's a crucial detail, yes. The reason the HIV spike is so hard to target isn't just because it mutates, it's because it also hides. It's covered in a dense layer of sugar molecules called glycans, the glycan shield.
Which acts like armor.
Highly effective armor. It blocks access to the underlying protein structure, especially those conserved sites we want to hit.
So just to recap, we're looking for a tiny static weak point on a heavily armored, camouflaged vehicle that's constantly changing its shape.
It sounds functionally impossible, I know.
It really does.
But nature has already provided the blueprint. We need to induce antibodies that are sophisticated enough to maneuver through or look past that dense glycan shield and land precisely on those few conserved sites.
That's the only way.
The only way to achieve the universal breadth of protection we need.
And this quest for the conserved target, the Achilles heel, that culminated in the concept that just revolutionized the field. Broadly neutralizing antibodies.
Or BNAbs, yes. It sounds like an optimized, custom-designed weapon.
It does.
And in essence, they are. The key breakthrough was the discovery that some rare individuals, people naturally infected with HIV, after years of immunological combat, they developed these highly potent antibodies.
The first ones were found back in the early 1990s.
That's right.
And given the extreme variability we just described, finding a single antibody that could neutralize a wide array of strains, sometimes hundreds of them, that must have been a massive shock to the research community.
It was a huge aha moment. It validated the hypothesis
That even though the vast majority of the virus surface changes,
those few constant structural elements or patches must exist and they must be targetable. The existence of BNAbs proved that a universal solution was biologically achievable.
Okay, let's get into what makes a BNAb structurally different from a standard antibody. If a standard antibody is like a small specific key for one lock, what does a BNAb look like? How does it neutralize hundreds of thousands of variations?
That's where the high engineering comes in. Standard antibodies are usually short. They target the easy-to-reach, non-conserved parts of the spike.
The parts that are always changing.
The decoys, essentially. BNAbs, however, are unique. They are often structurally elongated, or they have these unusual binding loops that let them reach deep into those restricted, conserved pockets on the spike protein.
The ones the glycan shield usually protects.
Exactly. They're not just looking for a static patch. They are finding the parts of the machinery that are physically inaccessible to less specialized antibodies.
So they are directed to those specific patches on the surface of the spike protein that don't change very much from one HIV isolate to the next.
Precisely. These are sites critical for function, like the spot where the virus first binds to the CD4 receptor, or sites involved in the complicated process of membrane fusion.
And if the virus mutates these sites,
it stops being infectious, it's functionally cornered.
Now, the sources mentioned that researchers had to spend a lot of time teasing apart different antibody responses. Does that mean that just finding an antibody that targets a conserved patch isn't enough? Are some BNAbs better than others?
Oh, absolutely. Think about it as a spectrum of neutralization. Some antibodies might bind to the patch, but they only block a few strains.
That's a narrow binder.
Right. Others might bind less tightly, but they block 80% of circulating strains. That's broad, but maybe not potent enough.
You mean both?
We need antibodies that are both potent, binding tightly, and broad, neutralizing a huge range of strains.
So the analytic deep dive is about filtering through this haystack of immune responses to find the needle, the highly refined antibodies that achieve maximum breadth and potency.
And this is essential because those targeted sites must be necessary for the virus's function. It's the defining functional constraint.
So these areas, once we identify them and can target them with BNAbs, they represent the virus's non-negotiable vulnerabilities.
Yes. The virus has maintained these structures for its own survival, and by exploiting them, we achieve the universality we need for a vaccine. This realization moved the field from, theoretical frustration to targeted structural biology engineering.
It's incredible that the virus's own survival mechanism is what ultimately gives us hope for its defeat.
Yeah.
But, okay, now we hit the hardest question. How do we get a healthy person's immune system to produce these highly unusual advanced antibodies intentionally and reliably?
This brings us to the methodology that defines the current exciting moment. The antibodies we want are described as very, very advanced antibodies. They are evolutionary anomalies compared to a typical immune response.
They need a sophisticated, guided developmental pathway.
That's it, exactly.
So if the immune system doesn't naturally jump to this level of complexity after a standard shot, what's the solution? The sources make it very clear that a standard single-dose vaccine just won't cut it.
No, it won't. The analogy used in the sources is key here. The process is more like training an elite athlete than giving a quick instructional lecture.
It's not a lecture. It's a training camp.
A training camp. The current thinking suggests it will require a specialized multi-shot regimen using multiple different shots of multiple different vaccine immunogens.
Okay, let's define immunogens in this context. We're not just injecting a weakened virus like in traditional vaccines. These are highly engineered tools, right?
That's right. An immunogen is the component designed to provoke a specific immune response. In this quest, these are highly engineered protein structures.
Designed to mimic only the specific conserved parts of the spike we want the antibodies to target.
Yes, and crucially, designed to be presented to the B cells in a way that kicks off the correct evolutionary path.
So if the ultimate goal is to generate a BNAb, the process can't start with the finished product. It has to start with a precursor.
Exactly. We have to educate the immune system. We are specifically trying to guide the B cells, the antibody-producing cells, through a process called B cell maturation. This is systematic immune engineering.
Okay, let's break down that training regimen using the athlete analogy. What is the first shot designed to do?
The very first shot, often called the priming shot, is like basic training, or maybe more like finding the raw talent.
The scouting process.
Yes. The goal here is germline targeting. We need to activate a very specific, very rare lineage of B cells, the ones that have the potential, the right starting genetic code, to eventually evolve into a BNAb.
Most immune responses start with common B cells that lead to, well, useless antibodies in this case.
Correct. So this first immunogen acts as a highly selective filter. It only binds to and activates those rare elite precursor cells.
So the first shot finds the specific athlete with the right inherent physical structure for the job. And if that first step fails,
the entire training sequence collapses. If we activate the wrong starting D cells, no amount of subsequent training will produce the highly evolved BNAb we need.
which is why the success of that initial germline targeting clinical trial was such a massive cause for optimism.
It proved that B cells can be guided onto the right evolutionary track.
Okay, so we've found our rare precursor B cell, we've scouted the talent. What does the subsequent training involve?
The following shots initiate the critical phase, which is known as affinity maturation, and it's driven by somatic hypermutation.
That sounds complicated.
It is, but think of it as the sophisticated, deliberate evolution of the B cell. When a B cell is activated, it goes into a specialized area, rapidly replicates, and purposefully introduces mutations into its own antibody genes.
The body's way of diversifying its arsenal.
It's a process of evolutionary trial and error, but happening rapidly and internally.
And we, the vaccinologists, we become the natural selection mechanism.
That's the idea. Each subsequent immunogen, the second shot, the third shot, presents a slightly different, more refined, and structurally complex target. It's like increasing the difficulty of the training exercise.
Okay.
Only the B cells that have successfully mutated and evolved their antibody to bind more tightly to the new, slightly different target get to survive and multiply.
So each shot is a rigorous test that selects for stronger and faster and more skilled antibodies, as the sources put it.
Stronger affinity, faster response, and broader skill, meaning they can bind to that conserved patch even when the surrounding viral structure has shifted wildly.
So the sequence and the structure of these different immunogens, that's the key choreography.
That's everything. We are deliberately guiding the B cells to evolve past the common antibodies and generate those highly complex, highly specific BNAbs. The challenge is making sure the series of shots pushes the immune response in the exact right direction.
Without accidentally activating pathways that lead to irrelevant or even harmful antibodies.
Right. It's a radical departure from traditional vaccinology, where the vaccine is often a single iteration of a threat.
Here, the vaccine is a sequence of highly specific challenges. It's designed to force the body's internal evolutionary process into a very specific, high-level outcome.
It is the ultimate expression of structural vaccinology. We are controlling B cell fate through molecular design. This multi-step training approach is what makes this strategy so novel, and it's why researchers feel they have finally gained the necessary control over the immune system to tackle HIV.
Okay, so let's tie this novel strategy back to that current feeling of optimism. It sounds theoretically brilliant, but what evidence supports the belief that this complex choreographed training sequence is actually viable now?
Well, the optimism is grounded in validation, in proof of the foundational steps. The researchers didn't just jump straight to the multi-shot finish line. They rigorously tested the initial concepts.
The clinical trial you mentioned.
The one that specifically focused on proving that the first, most crucial step, the germline targeting, was possible.
Finding the raw talent. And what did that trial show?
It demonstrated that the first engineered immunogen successfully found and activated those rare, specific B cells, the ones that have the potential to become BNAbs.
And the source material notes that it worked better than we could possibly imagine.
That phrase, worked better than we could possibly imagine, it tells you everything. It indicates a high degree of confidence that the B cells not only responded, but they responded efficiently and precisely in the way the engineers designed.
So if the first step in this highly complex immune training regimen works that well,
It vastly reduces the risk for the entire downstream process of affinity maturation. It confirms that the B cells can be steered onto the right evolutionary path.
it gives them the scientific license to proceed with the entire sequence.
Exactly. It moves the strategy from a brilliant hypothesis to a viable developmental path.
Okay, beyond the immediate HIV success, let's zoom out a little and look at the broader legacy of this decades-long struggle. Has all this complex research yielded benefits outside of the HIV field?
Absolutely. This is perhaps one of the most powerful and often overlooked outcomes of the HIV vaccine quest.
How so?
The experience gained by people working in the HIV field over the past 10, 20, 30 years, decades of trying to stabilize, design, and deliver complex spike proteins that provided foundational knowledge that was instantly transferable to other viral threats.
Can you give us a concrete example of that transfer?
The greatest recent example involves the rapid development of vaccines during the 2019 global health crisis. The infrastructure, the understanding of how to stabilize viral spike proteins for immunization,
A technology refined heavily in HIV research.
and the ability to design targeted immunogens. These were all pre-existing knowledge bases, largely built by HIV researchers.
So when a new viral spike protein needed to be manufactured and delivered rapidly, the researchers were, in a sense, already ready.
They were ready. The source references a vaccine that emerged in 2019 and was ready in a mere 10 months.
Which is historically unprecedented.
The fact that development was never so fast is attributed directly to the fact that, and I'm quoting here, people working on the HIV field in the past 10 or 30 years, so already gained a lot of experience.
Wow. They had perfected the tools for handling viral spike proteins and designing novel delivery systems.
That's right.
It's powerful to realize that the dedication spent trying to conquer HIV already saved countless lives globally by accelerating the response to other pandemics.
It was a massive investment that paid unexpected dividends. It confirms that the difficulty of the HIV challenge forced innovation in structural biology and vaccinology that benefits all of human health.
They were pioneers in dealing with highly mutable viruses.
And that knowledge is now the global standard.
Let's end this section by acknowledging the human element. Decades of work, constant setbacks, and yet the research community persists. What is the fundamental motivation they share?
The sources convey a very clear and deeply personal motivation. Researchers understand that their ultimate goal is not abstract molecular biology.
Right.
It is to save lives so people can go on and do what they want to do. It links their highly technical work directly back to the concept of human freedom and potential.
And the material describes this work not as a job, but as a privilege. That level of emotional investment is what sustained the field through the toughest years and what continues to drive them today.
It is the privilege of being the generation that might finally turn the page on a global tragedy, ensuring that those 1.5 million annual infections cease, allowing millions globally to live healthier, fuller lives free from perpetual risk and medication.
As we conclude this deep dive, it's really clear that the quest for the universal HIV vaccine has defined the cutting edge of science. Let's quickly summarize the three major strategic pillars that define this exciting moment.
Okay. First, the recognition that only a universal approach can succeed. And that's necessitated by HIV's extreme variability and its reliance on those conserved, unchangeable patches for its own survival.
Second, the key target. Inducing broadly neutralizing antibodies, or BNAbs, those highly sophisticated, evolved immune molecules that are capable of neutralizing an extraordinary range of strains by getting to those hidden, constant patches.
And finally, the novel methodology, the athletic training model for the immune system. This requires a precise sequence of shots, each with a structurally different immunogen, all designed to systematically guide B-cell evolution.
Through germline targeting and affinity maturation.
To produce the highly specific antibodies required for broad protection.
If this complex, multi-step training strategy succeeds, the impact will be revolutionary. It'll change the trajectory of one of the worst pandemics in human history and secure the health of millions.
And its implications extend far beyond that. The success or failure of this immune training model will set the precedent for how we tackle complex, mutable diseases in the future.
Which brings us to our final provocative thought for you to mull over. If we can master this technology, the systematic, sequenced immune training, to coerce the body to produce custom-designed advanced antibodies for a target as difficult as HIV,
An impossibly difficult target.
what other diseases that rely on mutation or camouflage, like certain persistent cancers or highly complex autoimmune conditions, could this methodology solve next?
We're talking about developing a general framework for immune system programming. The knowledge gained from this decades-long struggle with HIV is creating a universal toolkit,
A toolkit that prepares us not just to defeat AIDS,
but to accelerate the end of many other infectious and complex diseases we currently deem insurmountable.
the ultimate legacy of the HIV vaccine quest may be defined not just by the lives saved from HIV, but by the new era of vaccinology it ushers in.
Thank you for joining us for this deep dive.
We'll see you next time.